Dr. Leigh Erin Connealy, welcome to the podcast.
Thank
Before we
you.
start, your name is pretty Irish. I spoke to your daughter, Alana, 3 times she's been on the podcast. And I said, Alana, am I one of the only people that says Connealy right? Because and the same with Erin, like, do people generally say that wrong?
Yeah, well, most people they say Leigh when it's really Lee, and then Erin means Ireland, right? And then Keneally is a very Irish name. So
It's,
they don't understand, and most people who don't know me, they call me Lee or they call me Erin, but not Leigh Erin. So
yeah. Well,
it's a very
it's the pronunciation that counts. And Irish people were very particular about pronunciation.
right. That's very true. Well, your name is very important,
It
right?
is. It is.
Yeah,
It represents not only who you are, but what you stand for as well.
right.
So,
Exactly.
for a lot of people that don't know who you are founder and medical director of the Center for New Medicine and the Cancer Center for Healing. And you're in California, but you're also advisor to Reina Health, which Alana, again, your daughter, she's been on the podcast 3 times and she's awesome. So, she is founder of that. So, you've got a whole big system going on there between the two of you.
Yes, well, she probably grew up hearing me talk about so many things.
Mhm.
And then I think because her health journey kind of like I think she just did a lot of self-discovery and started studying about health and found so many different rabbit holes to where she is today. And hormones are very misunderstood and they are not really recognized to the place that they should be
Mhm.
and how critically important they are. And so Raina is able to reach a lot of different people because, like if people have to come to my center, the Center for New Medicine or the Cancer Center for Healing, that might be difficult. But if we can reach as many people as possible and help them with their hormones, just think how much better the world would be.
Yeah, I know a lot of it does come down to hormones. But we didn't come here to speak about Alana. We came to speak about you and cancer and all things around that. But let's start just with how you were pushed in the direction of cancer, starting with your mom's pregnancy, because I've heard you tell this story a few times. And out of all the kind of our mess becomes our message stories I hear, this one really interested me. I think because how you tell it is like, whoa.
Yes, it's very interesting because grew up in Texas and I'm number three of six children. My mother started bleeding and she went to the doctor, and the doctor said, "We have a medication that will stop the bleeding and prevent miscarriage, loss of your baby." So she did that, of course, back then. This was in the 50s. And so then I'm a teenager, and my parents receive a letter stating that medication caused many complications after birth. And that included hormone problems, infertility problems, anatomical problems, cancer, all kinds of things, depending on when it was given in utero. And so for me personally, I never had two periods in a row in my life, never had children the natural way, developed scoliosis because if you give estrogen a certain time period, it will stimulate the neurological progression. And then I also had lots of different detours because when I didn't have a period, I would go into severe PMS because you're just like your body wants to have this period in this cycle. And so when I was in high school, I loved biology. And I thought, okay, what could I do that I could use my science background and talk to people? So I thought, oh, I can be a doctor. And I babysat for a doctor. So I thought, okay, I'm going to go to medical school. So I went to medical school. And then I said, Lord, luckily, I grew up kind of natural, meaning drinking raw milk, sauerkraut, liver pate, all the things that are kind of fashionable now. And then I just thought, okay, if that one drug affected me that much, we are taking drugs every day. And cardinal rule number one, never take anything in pregnancy. Never a medicine. Okay. Nothing. You want to not take antibiotics. You don't want to take pain pills. You don't want to, I mean, when I say pain pills, Tylenol, ibuprofen, you don't want to give vaccines during pregnancy. You don't want to do anything that interrupts because think about it, it's only 9 months.
Mm.
So anytime that you take something could possibly interfere or disrupt the natural maturation process of an embryo.
Mm-hmm.
So, and then you're also have to think about the external influences of things on the embryo. So you want that to make the best miracle possible. We want to really cherish and respect that pregnancy time.
Yeah.
And so that's one thing, like in my future, when I have some more time, I would love to educate the women who want to become pregnant, like how to get in the most ideal state to produce that miracle, starting from a spiritual, emotional, physical, endocrine, every single facet, because the outcome will be, really wonderful children, right? And so, but I right now, I mean, it's something I envision, but right now I'm doing what I'm doing right now, but that will happen. And I already do it on a little bit basis. I already take young people because my daughter's 31. So her friends all ask me and I send them things. Oh, you got to read this, you got to do this, you got to do that. So I'm already kind of doing it. But I think we need to really teach public health from the time a mother wants to have a child. Okay.
Yeah.
And so anyway, then, when I didn't have my period, I met this doctor and he told me that you need to balance your menstrual cycle with progesterone. Well, back then it was injectable progesterone because they didn't have available what we have today, creams and pills and all kinds of things. And so I would inject myself with natural injectable progesterone half of the cycle. And so then when I quit the progesterone, I would have a cycle and I never really ovulated properly. Okay. Because my babies, I had to go to infertility doctors to have my babies because I did not ovulate. I tried to do it on my own, but it wasn't working. Even with medication, it wasn't working. But progesterone saved my life, literally made me create some kind of homeostasis in my body because every woman has a natural circadian rhythm and cycle. And she knows when her period is, right? And she knows when she ovulates. It's a very, very significant part of her natural rhythm. And not having that ever, your body you've got to really coax it and make it more normal, right? So progesterone really helped me. And then as I've aged, of course, I have other things, other hormonal optimization that I need to do. Yeah. And then all of this has between my patients asking me questions and between my own journey, because trust me, there is no book that describes this properly and gives it the visual picture and the physical picture and the emotional picture that hormones have in your body. Your hormones are the natural drugs to your body. All right. And it's not just female hormones. All men and all women have hormones the same, except a man has a higher testosterone and a lower estrogen. A woman has a lower testosterone and she will have a higher estrogen. And then we need to address the entire endocrine, which starts with your hypothalamus up here in your brain, your hypothalamic. I call it the brain's brain, and it sends a message to your pituitary. And then your pituitary makes all these stimulating hormones, whether for prolactin, for thyroid, luteinizing hormone, follicle stimulating hormone, thyroid stimulating, adrenocorticotropic hormone. So if this hypothalamic pituitary axis is not great, then your end hormones aren't going to be good. So it's not just checking the hormones in your body from the neck below. It's how is the brain's brain and the pituitary working? How is that hypothalamic pituitary axis working? And then women have thyroid, they have adrenal, they have pancreas, and they make ovaries. Men have thyroid, they have adrenal, they have pancreatic hormones, and then they have testicles. And now I would say that most people today, early on in their 20s, have hormonal imbalances, insufficiencies. I would say I see it a lot because I know what's normal in a 20-year-old. You have to know what's normal for a 20-year-old. And so what I see is that most of the men have low testosterone. Most of them have low DHEA. I was just looking at one of my patients' blood tests. He's 37. He's coming to see me next week. He has Hodgkin's lymphoma, and I always check the hormones. Estradiol was high. I was like, wow, why is his estradiol high? That's interesting. Okay, he's 37. How's this happening, right? Okay. And then you can't forget about if people have low thyroid, right? You automatically increase your risk for many diseases, right? Cancer being one of them, all right? Not to mention all the side effects of having a low thyroid. Your thyroid, I call, is the battery to your body, okay? And if you don't have your thyroid working, the cellular energy, or what we call voltage, isn't going to happen because everything is a function of your quantitative T3. And most doctors are not assessing a thyroid panel completely. So you need to know what's your TSH, free T3, free T4. And since Hashimoto's is very high these days, you have to take that into consideration. That's when your thyroid starts attacking itself. And that's really increasing these days, okay? So the endocrine system is the critical part to your body functioning. So I told a patient yesterday, because we were talking about adrenal glands, and adrenals, they're little glands that sit on top of your kidneys like little hats, and they make 100 hormones. DHEA sulfate being the predominant one, and then cortisol, but it makes all kinds of other hormones, okay? And so I tell people you can't give yourself 100 hormones. So that means you've got to fortify the gland to make it work. You mentioned you take the desiccated thyroid, okay? So you're taking desiccated thyroid, which is great, to fortify the functionality of your thyroid. And, that is considered what we call cell therapy, okay? So there was a doctor, Dr. Paracelsus, 200 years ago, said that we should be treating organs with organs. So if your liver's not good, you eat liver. If your heart's not good, you purify heart, etc. That's why, the Weston Price Foundation is all about organ meats and organs. And, now we make glandulars and all kinds of ancestral supplements to help fortify the anatomy of our body, okay? And like treats like, okay? So that is a very good. Now, obviously, you have to fortify your gland. And one of the things that you always have to think about with your thyroid is heavy metals.
Yeah.
Heavy metals are ubiquitous in the environment. Heavy metals interfere with the function of every cell in your body. But one thing I find for the thyroid especially, the thyroid is very susceptible to two toxins. A lot more, but the major toxins are electromagnetic fields and heavy metals. And unfortunately, we're living in the great poisoning, and the air is polluted, the water, the food is polluted. So whether you don't have anything or you have a diagnosis, we all need to be purifying our body on a regular basis. All right. And whether that's Epsom salt baths, whether it's sauna, whether it's, cleanses, there's all kinds of good cleanses out there. But that is something we need to be doing really on a regular basis because we can't keep up with the assault that's happening on our body. So I believe that thyroid function has increased a lot because of just the increased concentration of toxicity and the increased concentration of heavy metals and other toxins. All right. So, and then going back to your adrenals, because if your mother is not endocrinologically optimal, she is going to transfer that to the baby. That's why it's very important that we get the women as optimal as possible so that their offspring, and I just read in JAMA this year that 25% of our children are chronically ill.
Yeah.
Now, how can that be when we know what we know, but we're not acting upon what we know, and we're not instituting check and balances with the civilization that's going on today?
Mm-hmm.
And I say, I'm much older than you guys, but we need to go back to where we were 50 years ago. And 50 years ago, there wasn't the EMFs, there wasn't the toxicity, there wasn't the stress, there wasn't, food was way better probably back then, had so many insecticides and pesticides. It didn't have the toxicity we have today, didn't have glyphosate, right? Weed killer. So we really need to kind of go back and go back. I know a lot of people don't, but I do think that the mothers today, the 30-year-olds today, are becoming very conscious of the living environment of their child now. Okay. So I'm very hopeful that young people are going to be the change that we need for the future. Because how can 25% of our children born in 2025 already being health challenged? Okay. I used to say you have a warranty until you're 40. And now I can't say that because I was reviewing records with one of my new doctors. And I was going over the record of a young patient I have today. A young patient. She's 26 with stage 4 breast cancer.
Oh.
Okay. ER positive. Okay. And so she's doing very well though. And she's very, 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 her PET scan's clear now.
Good.
And so, and she's being very good about everything. All right. Now she is on my protocol with medicines, but I told her, because she wanted to start getting off some of her medicines, I said, it's only been a year and a half. Give me 6 more months of you being consistently stable.
Yeah.
And then, because, she's, on estrogen blockers and she's on, bone preservation, et cetera, et cetera. And she's on a medication. Also, they call it a CD4/6 inhibitor. And so I told her, so let's just stay stable. You're doing great. You're fully functional. You're looking healthy. You're acting healthy. Everything is good. And all of your numbers. And then I do a lot of tests that can look deeper than a scan. Mm-hmm. And I said, everything is looking great. So I said, her mother was with her. And I said, let's now go to the next kind of form of treatment, because in conventional world, our treatment is a protocol.
Yeah. And
protocols are not the only thing you should be doing to take care of yourself. All right. Like the protocol in the book on page 737, right? We need every individual is an original. So we need to be treating patients, and we need to look constantly for updated non-toxic treatments to help our patients. So, because the patient is in front of you now, there may not be a double-blind clinical trial, but as long as it doesn't hurt the patient and it sounds scientifically possible, we should be able to utilize these treatments on our patients, because we have a responsibility to get that patient well and to create health in that person.
Yeah, that's scary for a 26-year-old for sure, but unfortunately, it's not as uncommon as we would like it to be nowadays, especially after COVID. And I will say it, and I'm sure you've seen the research, the cancer rates are up since all of that, since the vaccines. I know a lot of people, for some reason, still don't want to hear it, but the proof is in the pudding, as they say. The research is out there. The files were released. We can see that cancer did go through the roof, unfortunately, especially in our young people. And you have children, I have children. None of us want to see our children go through this. And we would probably give our own lives to protect them from any harm. But this is real and this is what's happening now. And it's podcasts and conversations like these that are hopefully not opening eyes, but opening ears to other ways. There's other things. So we're into the cancer topic now. Dr. Connealy, before we go any further, because this wasn't covered on my other two cancer conversations with the
Perfect.
guys, can you tell us, like just really quick, what is cancer and what causes cancer?
Okay. So cancer is extreme chaos, uncontrollable disorder, out of control. All right. And what causes cancer is so interesting because I had a young lady come in today from New York. She's 44. This is a very important story. She decided to get breast implants in 2016. She's 44 now, so about 10 years ago. So she was in her early 30s and she decided to go get breast implants, which is very common, right? Worldwide. And very shortly after the procedure, she felt a lump in her left breast. And the doctor said it's scar tissue. She continued to see the doctor, and the doctor dismissed the patient. Well, then she saw her a year later, and the tumor was huge.
Yikes.
Okay. So I always tell patients, and I want to do a special thing on this because I hear patients go to the doctor doesn't listen and doesn't do any evaluation. So I asked her an important question. I said, what imaging did you have before the implants? Because you should have good imaging before the implants. Make sure everything is kosher and good. Now, in a 34-year-old, there's not real good imaging because mammograms they don't recommend because it's too much radiation and also too much false positive. Yeah. But ultrasound would probably be your best bet, or the new breast imaging that they have is QT, which is FDA approved, okay? So some kind of imaging. So anyone out there listening and you're thinking about getting breast implants, and I would tell you probably not to get breast implants.
Save your money.
I would tell you probably not to for a lot of different reasons, but that could be another conversation because it's a foreign body and there's many, many reasons, right? But to make sure your breasts are pristine before you get the implants. Then if you go to a doctor and you know your body, the doctor doesn't know your body like you do, okay? And you go to the doctor and say you feel something, demand attention, demand some kind of evaluation. And in the conventional world, we don't have really good evaluations, okay? I have more because I'm seeking more. But in the real world, keep digging down deep, okay? And then now she's been fighting breast cancer. She's full on stage 4 for quite some while, just gone from one medicine to another medicine to radiation to medicine to medicine. So what kind of shape do you think she's in?
Not good.
Not good. And she's only 44. And I'm like, okay, so what things I said, what have you researched to know how to change, the environment of what's going on? And like, it wasn't until a dentist told her, like, oh no, you need to go see a doctor who can do both. And she, had never really researched into what are the things she could do. And so I explained to her, I said, Otto Warburg, 100 years ago, said that cancer is an acidic environment. We have a natural pH 7.43. If your pH just goes down a little bit, it changes the energy or the voltage, and more importantly, the oxygenation to your tissue. So you have an interruption of aerobic glycolysis turning into anaerobic without oxygen. So your normal cycle of energy, it's called the Krebs cycle of energy after Dr. Krebs, and we make 36 ATP. In the anaerobic, when there's no oxygen, you're making only 2 ATP. And so you have acidic pH that automatically makes lactic acid. Lactic acid makes it incites something called hypoxic inducible factor, which means low oxygen. Okay. So when you have low oxygen, what happens to all your tissues?
Dies.
They all cannot work. They all become non-functional. And so what happens is you have more acidity, more growth of all bugs, viruses, bacteria, fungi, and parasites. The energy and the voltage of the cell goes low, and so it can't take care of the cell. And it's not just one cell, you have 50 trillion cells to take care of. And then you have toxins that can't be removed because it has no energy. You have heavy metals that can't be removed. So it has no, because it has no energy. So you just have this cycle going on, and then one cell goes into 2 to 4 to 6 to 12 to, all the way up. And then when it gets to 1 billion cells, it's about 8 years in the making. Oof. So that means, though, that we have all this opportunity to prevent cancer, though.
You had 8 years, yeah.
You had 8 years, but we don't focus on health. Okay. And when we focus on health, what is health? So I have my definition, and I'll tell you what the WHO definition is, which is physical, mental, emotional, social well-being.
Yeah, I would include spiritual, and I think you mentioned that as well. Yeah.
Yeah. So I would say it's spiritual, emotional, intellectual, biophysical, biochemical, bioenergetic. Okay.
To come up with a good acronym for that.
Yes. So, yes. Okay. I will. But anyway, that's what it is. So it's so interesting with this lady. I'm explaining to her how cancer works. So then I said, okay, you had this surgery, you had this chemo, you had this other drugs, you've had radiation. I said, what do you think has happened to your pH levels? You've just added injury upon injury upon injury, upon inflammation, and on top of invasiveness. And she hasn't done anything, literally nothing other than she eats well. That's the only thing she does. She does do yoga. She does do meditation. And so it was very interesting when I asked them always, tell me how your sleep is. What kind of water do you drink? What eating, what you're eating, and, what is your movement, and what is the status of your teeth, because your teeth are the gateway to the rest of your body. And many people had mercury fillings, root canals, dental infections, etc. And then I said, tell me what's been your stress for the past 20 years. Why? Because she had cancer in 2016. What happened before that? So she says, well, I took birth control pills for 10 years. So we know the complications of birth control pills. They're a synthetic estrogen, a synthetic progesterone with no protection. Okay. She said, I've had stress my whole life. My mother's an alcoholic. My dad, I never had a relationship. We kind of sort of have a relationship. I have 2 children. My husband worked all the time. I had stress raising the children. Well, you shouldn't have stress raising children, because you don't want to be stressed and have kids, right? Because
stress parents make stress kids.
Yeah, exactly. Correct. That's exactly correct. You're going to project all your stress onto your babies. And so, having a child it's really, I know I've had kids. It's all the time, but that's what it is. Like it's just what it is. And it's a beautiful experience. And a lot of mothers today say, oh, I'm so stressed because of my kids. And I'm like, wait, your kids are causing you stress? Like, no, I think it's all how we look at it. They're a lot of work because that is what you're here for, is to work. Life is work and work is life. Okay. It's not supposed to be that you're relaxing on the beach and, it's vacation. It's not. It's called literally 24/7 because hopefully you'll get your baby to sleep, but it's 24/7. And that's like, look at it beautiful. When I woke up with my twins at 2 o'clock in the morning to feed them, I was like excited to see my babies. Okay. I didn't look like, oh my God, I'm not getting sleep. Da, da, da. I didn't look like that. I was young. I was 30 something years old. So, but we need to say that, and it's time to just live live life with them, find the beauty and happiness in that child's life, and you being in communion with them. Think about it.
Dr. Connealy, I would put forward an argument, and I think on some level you would agree with me, that a lot of the reasons, that probably the main reason why a lot of moms are saying, I'm so stressed, my kids are stressing me, is not necessarily because the kids, but it's because these moms already have metabolic health issues. They are in poor health, so they are
To
not
begin with, so they
capable to
to
deal with
rise to the
stress.
occasion, to
Yeah,
rise to the occasion.
yeah, because
And you're
they're
probably
running,
right.
yeah, they're running on empty on every single level. It's
Mhm.
and giving love takes a lot of energy
It
sometimes.
does.
It's a lot, and
Well, you
meeting
have to
other
have, you're
moms.
right. You have to have the physical energy and emotional and spiritual energy. You're
Mhm.
right.
And I
You're
appreciate you sharing this story of this unfortunate woman. I'll keep her in my prayers. But as much as we talk about stress all the time, and you've been on many podcasts and I have, and we're always talking about stress. And
right.
I know on some level, most people understand, okay, stress is bad. But at the same time, I still don't think a lot of people understand that stress is bad. Like it's a
Well,
double-edged sword.
yeah, it is because stress is your strength. You wouldn't have strength if you didn't have stress, right? And it's not the day-to-day stress, really. It's the extraordinary stress. Okay. The stress of day-to-day living is not the problem. It's the extraordinary stress. Okay. Like, I always talk to my patients about what they've been going through. All right. So if they've been a caretaker for 10 years, if they lost someone that was the most important person in their life, if they've been molested as a child, I mean, it goes on. They've been under extreme work stress and something catastrophic happened. So usually it's something very, very, what I call extraordinary stress, because the day-to-day stress is not the problem. It's the extraordinary stress. Like, what if your parents were going through a divorce? Like this young lady, her mother's an alcoholic, and from what I understand, is she's still an alcoholic. And it's so funny because and I said, are you close to your mom? She said, yes. And I said, well, did she quit drinking? No. So she still now is an adult child of an alcoholic that's still drinking.
Yeah.
So how is that going to help her? That's not going to help her, right?
She's probably still helping her mom as well while
And
trying to.
that's exactly what she said. She goes, I'm the mother to my mother. And no wonder she can't enjoy her two babies they're not babies, they're 16 and 18, because you're exactly right. She's mothering her mother and who else, right? Because breast cancer is unrest in your nest.
Yeah.
And so we always, you probably know the book, The Body Keeps Score, right?
Yeah.
And so the body keeps score of everything. And then if you read Gabor Mate, who's Canadian, he's wonderful. He says we inherit 15 generations of trauma. And I was doing a podcast and he says, like, what is, one of the top things that any person can do to prevent cancer? And I said, we need to take an inventory of our spiritual, emotional self. Are we good? And don't rely on yourself. We need to be vulnerable. We need to go ask our best friend, like, what do you think? What do you think about me? what do you think? Like, do you think things are going on that I should address? Because we can't be objective about ourselves, okay? But your best friend, that's someone who loves you unconditionally, talk with them. Maybe it's your parent, maybe it's your best friend, but use your friends as a kind of a counselor, so to speak, so that you can take inventory appropriately of yourself and do the work that you can to resolve unresolved emotional conflicts. Because a lot of times I see patients, they just are the first time looking at their life. For the first time in their life, they're like, well, I've never really thought about that.
Yeah.
And it makes them think, like, who am I? What am I? Where am I going? Do I have the wherewithal to go where I need to go? And so you're right. So I think, and I do think that young people have more stress today because the demands of today, it's 24/7 on the computer, on this text message, computer, it's just nonstop. When I was 30, we didn't have that. We didn't have that constant connection. Plus, I believe it's created disconnectedness.
Oh, for sure.
You're not going out and having tea or coffee or whatever with your friend because you have your phone and you send them a text, but a text is not real. Okay. Yes, occasionally, but it's not authentic connection. And community is the guru of the future. So we need to have touch and feel, hugs and love, and sit down and see when someone eye to eye. That's why I don't take patients anymore unless I physically see them. Like, I need to physically touch and feel you. And I can't get a proper exam because how much is spoken in your body? 90% is spoken with body language.
So, Dr. Connealy, you mentioned in passing, but this is one of the topics I mentioned I wanted to cover. You mentioned one of the cancers being E2 positive. And funnily enough, I had this conversation with a lady this morning in perimenopause, and we were discussing her hormone therapy. And I just said, by the way, I'm just curious, why are you on estrogen when you're still cycling? And I know this woman well. She takes very good care of herself. She exercises well. Like I know her. She takes care of herself. She does
She's
all the
on
things,
it.
which she mentioned in her response that, well, the research is not solid on estrogen being a carcinogen and driving cancer. And in the same sentence, she mentioned, but I want to speak to my doctor about it because since I started this, my cycles are all over the place. And I'm like, how can two things be right when they're clearly contradictory?
Right. That's a very good question because when women are young, they probably have good estrogen levels, probably. Okay, and I say probably because today it's very, you see all kinds of different things, okay? But when you're going through perimenopause, which can be, really can start 35 to 40, okay? And then usually 40 to 50, you're in perimenopause, which means your hormones are starting changing from 35 on, okay? And what you're experiencing, the next person are different. So you have to look at that. So I look at it as I say, okay, I listen to the patient because the patient has all the answers. Okay. Number one, listen to the patients. Number two, I will do blood test. I usually do blood on day 19, 20, 21, because that's when your estrogen, progesterone are your highest, okay, especially progesterone. Progesterone's low in the first part of your cycle. Then you ovulate, and then you make estrogen and progesterone. Then you also have to check the pituitary, hypothalamic pituitary axis to check your FSH and LH. So if this person has a FSH and LH that's quasi-normal, then you got to look at the estradiol level in the blood. You can't assess tissue estradiol, but you can assess estrogen through the blood. And if the estradiol is good, I would never give someone estrogen. Never. Okay. First of all, the last thing women want is things that can cause them to gain weight. And estrogen can cause you to gain weight, not to mention tender breasts, bloated tummy, and weight gain. But you should never take estrogen unless your body needs it. And you look at the levels and they're low, your FSH is high. And there's, like when I check women, their estradiol 0, okay, in the blood, okay. And so, but I will try someone out first on progesterone, look at their adrenals with their DHEA sulfate and maybe a saliva cortisol test. And then I look at their pregnenolone. Your pregnenolone should be about 100, all right? And if you fix those hormones a lot, you can fix the body without even estrogen, because not only is breast cancer estrogen sensitive, but many other cancers are estrogen driven. And it's not that your own body does that. It's the environment of the xenoestrogen. So you combine the xenoestrogen with your own estrogen, and we have a cocktail that we don't even all know what it is, because how it manifests in you with your mitochondria and how you detox in someone else. That's why we have to individually assess someone, and we got to make sure your liver's healthy so that you can process the things that you need to be processing, because you have 3 phases of detoxification in your liver. And so if your liver is not, metabolizing things properly, then we cannot have the proper detoxification of hormones. And so I'm very cautious about giving a woman estrogen. They absolutely must have it and need to have it in order for me to give it. Now, if you have breast cancer, I will not give that, because you want to make sure someone is, like, I usually wait 5 years. And if they need a teeny dab of a combo estrogen topical, I will do that, but very low dose. Okay. Because if they have a history of ER positive, PR positive, which is about 65% of cancers, you don't want to give estrogen for that, is one of the potential fuels.
So I'm curious before we get on to the sugar conversation.
Yeah.
So you mentioned that you test estrogen in the serum, but Georgie, as you know, Georgie Dinkoff, Morley Robbins, a lot of other practitioners are adamant that testing hormones in the serum is a waste of time. And you do want to look in the tissue, because unless you look at the tissue, which is obviously very hard to test,
Yes.
and you don't know what is happening at the level of the tissue and how it's being
Correct.
converted and utilized and at the receptors. So is it a case that it's just too difficult to test in the tissue, so you prefer the serum, or is there another reason?
I do 2 ways. I do capture an estradiol, and I do it at different times of the month also. I don't just do it at one time of the month, right? I will do it at different times. And then I also, a lot of times, will do a 24-hour collection of your hormones to see how your body's metabolizing. So I put all the picture together.
Mhm.
And more importantly, just don't rely on paperwork. Again, we need to be listening to the patients.
Mhm.
Okay.
Yeah. Yeah.
So yeah, tissue, like, I was listening to a lecture about, they were taking biopsies of fat to look at the toxins. Okay. Well, that is not a reasonable procedure to be doing. Okay. To assess somebody's toxic load. Okay. So yes, fat tissue is a good, especially, that's going to be a high depot. All these toxins and estrogen are stored in our fat. So you just have to, use the best we have available. All right.
I had a woman ask me on Instagram, she saw, because I shared one of your posts, and I said, "Oh, Dr. Connealy's coming on the podcast." And she's like, "I'm so excited." She said, "Could you ask her?" She said she'd had the Marina for a couple of years, I would guess 20 years, and now she's in her 50s. And she's wondering what your opinion is on the Marina and birth control in regards to the cancer, but also heavy menstrual flow.
Right. Well, I would never recommend an IUD with hormones. Okay. So I tell patients if you're going to use an IUD, which is obviously there's a price to pay for everything, right? Because an IUD, when you put it inside, it causes chronic inflammation, right? But I would never take, and I tell all my patients, if you're going to do IUD, do not take any, demand that there is no hormones. And then the other question you said is about,
Well, she
uh,
was using it for heavy flow,
oh, I would never
menopause.
use, I would never use an IUD for like the doctors who give birth control pills for every single thing, heavy flow, all kinds of menopause. They're using it for menopause. They're using a heavy flow. They're using it acne, all these things. You don't just go, you balance the hormones.
Yeah.
Please, you should not be using a foreign body to that is going to affect your physiology and anatomy. Like it doesn't make sense.
But this is what they're being told to recommend in the medical dictionary. Like this is what you can do. What you can't, for some reason, prescribe micronized progesterone, but you can give a 45-year-old woman an IUD to stop her heavy bleeds.
Yeah, exactly. When what I do with my patients is I always look and get a documented ultrasound. Okay. Ultrasound is really good imaging of your pelvic organs. So you should do that and then check their hormones. There is no downside, really. I've never heard of a downside story to giving progesterone. Never. Okay. I personally have been on progesterone injection and now time release pill for probably 40 years, 38, 35, 40 years, something like that. Okay. And so you just would never, there's no reason to do that. So I had a patient recently. She came to see me 10 years ago because her entire family died of cancer.
Oh,
Her sister also came, they came together and they were in their 30s and literally in their 30s concerned about cancer prevention because everybody, so they came in. I found breast cancer in one and ovarian in the other one. Now, it was only in a blood test, not physically. It wasn't physically evident, not on imaging on of any sort. Okay. And so then we reversed that. Now that was 10 years ago. So now she's in her 40s. Her menstrual cycles are heavy. She's having premenopausal symptoms. She's having thyroid symptoms. She's feeling horrible, losing her hair, and all kinds of things that happen, with women. And so I fixed her thyroid, then I gave her progesterone, and then I gave her something to reduce her estrogen. I said, right now, let's just do that so your periods are not so heavy. I took that away yesterday. I said, you don't need that now, and just to cycle your body with progesterone. And then she's taking her thyroid and she's taking DHA, but her hair problems resolved, the periods resolved, her symptoms are resolved just with simple little things.
hey,
And so that's the way but doctors need to, okay, what we're taught in medical school is not what we're talking about now.
yeah.
And if you read any endocrinology book, they don't really talk about these practical, simple ways of how to handle. And then, like, you're different than someone else. And so we have to sit there and listen so we can properly individualize your treatment plan. And doctors don't have patience for that.
Yeah.
They don't have time, they don't have energy, and they don't have patience at listening to everybody's story. And I love figuring out everybody's story. Like that's like fun thing to do. All right. But, and I guess maybe because I went through it and I didn't have people helping me. So I have so much more under a deep, personal and professional understanding. And so, but I do think it's a growing field. But I saw a patient who came to see me for cancer. She was in a very bad car accident and had a pelvic injury She ended up needing a total hysterectomy, which was removal of all organs. That was in 1994. So she was very young.
Mm.
And no one gave her hormones this whole time. Okay, because she's now in her 60s. So 30 years, no hormones. Okay. I don't really even know how she worked and functioned. So she went to go see a hormone doctor. And I said, well, he's giving you estradiol. Did you check your estradiol before? And he gave her estradiol cream for her vagina. And I said, but you're missing the entire endocrine system.
Yeah.
I said, what was your pregnenolone? What was your progesterone? Nothing else. He didn't give her. And I said, so look, this is what you need. Like, let me explain to you the physiology of what a woman needs. Let's see all your numbers, etc. And so she goes, well, he didn't mention any of these things. So the doctor needs to know the entire hormonal spectrum because every hormone's important, right? Like when you make chocolate chip cookies, if you forget one ingredient, the cookies aren't going to come out.
You know, one thing have said many times in the past, and I'm sure you'll agree, is you can graduate from medical school and come out with an MD at the end of your name, but you might have graduated at the bottom of your class. And now
Right.
you're out there helping people. Um, anyway, so we're coming up on time now, Dr. Connealy. I had one last question. This is the topic of the hour. What do you think about the argument that sugar causes cancer? And I'm going to refine this because nobody ever does. And I kind of mentioned this to I had Johnny Bowden on the podcast, and he was arguing that all sugar was bad. And I was like, I don't think it's fair. I think we need to not narrow down, elaborate on what we mean by sugar. We're not talking about table sugar or fruit or sourdough bread. When we're telling people sugar is bad, we're talking about your frappuccinos, we're talking about your donuts, your pizza, your fast food. We're not talking about sugar, how many people perceive it as everything sugar. So,
That is so true.
what do you
Well,
think?
yeah, first of all, that is a very common misunderstanding. And it's basically I remember in the beginning, I said your body has aerobic phosphorylation and you have anaerobic. And what happens is you have a very inefficient form of glycolysis. And what you have is fermentation. But cancer cells don't feed off sugar. They don't. People think that, but they don't feed off. It's the environment, the inefficient form of metabolism that causes the fermentation of these bad metabolic fuels. Glucose is, present, but it's not the determining. And then no one talks about glutamine. And glutamine is the other fuel for cancer. And that's much harder than treating the sugar part. But you're right about sugar. There's great sugars like raw honey, fruits. Oh, there's lots of great sugars, okay? But you're talking about bastardized foods, cookies, candies, pies, and cakes that are not made with authentic, real ingredients. You're talking about sodas that are with fructose sugar, which causes fatty liver. I mean, you're talking about the bad sugar that is like it's to simulate the sugar molecule, but it's not healthy for you.
And it
But if
usually comes with extra calories as well, these
yes,
fast
and
foods.
you're creating metabolic syndrome.
Yeah.
95% of the population has metabolic and mitochondrial dysfunction to begin with. So what you're doing is you're fueling other diseases, right? Like being overweight or obese, and you're creating all these other diseases. It's amazing when someone drops their weight, how they don't need medicine, how their blood sugar gets in line when they're following the rules and laws of the human body, which is just eat real food. And then you've got to move your body. Most people don't move their body. Most people don't get sunshine. Most people are in high stress. Think about how high stress causes increased cortisol. Cortisol causes your blood sugar to go up. So you may eat perfectly, but if your cortisol is high, you are going to have, high sugar levels.
Hmm. Yeah.
So it's not so simple. It's not a simple little,
It's not, but a lot of these, and it's quite annoying to me, these carnivore, keto, primal proponents constantly saying all the time, sugar, it's sugar that's the demon, it's sugar that's making you sick, it's sugar that's making you inflamed. A lot of the time, there's usually a product behind why they're saying this,
yeah.
but they're not differentiating between the types of sugar. And then we have people saying, well, I feel so good since I started carnivore, I lost all this weight. It's not because you stopped the sugar, it's because you stopped eating the junk food.
Yeah, that's exactly right. That's exactly right. And you need some good fats, you need protein, and you need good carbs. You need all those things. And you should have them properly represented in all of your meals.
We're going to wrap up now. I didn't tell you because I didn't want to influence where the conversation would go. I was diagnosed with cervical cancer in 2020, and they offered me a hysterectomy. And I was like, are you insane? Like, why would you offer? I was in my early 30s. I said, no, no, like I have been in the health industry for 20 years. I'm going to take care of this myself, which I did, thankfully. And I went, my first line of action was molecular hydrogen and European mistletoe. And I know you're a fan of both of those. And now I did all the other things, the blueberries, the dark chocolate. But just where this is going is what you said. At the time, I was like, how could this happen to me? I'm slim, I'm healthy, this is my career, I know what I'm doing. And I knew at the end of the day, I said, this is stress. This was stress that did this to me. And since then, I've been very, as much as I would love to avoid all stress, but I've been cognizant that I don't want to manifest. And I said it to a client recently who got currently a bit of a scare. She has to go for a biopsy. I said, you do not want to manifest that. You go sing, dance, watch funny movies. Do not give this any thought because I really think we can manifest a lot of this stuff. And that's a big no, no, no.
Yeah, you are absolutely right. So, at what point of time did you realize that it was stress?
Apart from all the stress. My doctor was no help. She gave me, I knew something was wrong with me. She gave me treatment for candida. And I was like, I don't have candida. Like, this is ridiculous. So I kept pushing, and she referred me to this wonderful gynecologist in the north of Calgary who sat me down and said, well, look, we found a mycoplasma. This is why you're having the symptoms, but we also think there's something else going on. And that's where the ball started rolling. And they're very, very good. Like here, I can't speak highly enough of the oncologists and gynecologists in Calgary when their
Nice.
bedside manner is very good. And they're surprisingly enough, because I have experience with the medical system in Ireland, obviously they're very open. If I want anything, if I want tests, if I want prescriptions, if I want an MRI, my doctor literally laughed at me when I said I wanted an MRI to just check there was no more cancer anywhere. She laughed. So I went straight to the oncologist and she wrote it for me straight away. I had an MRI the next week. Like they're very good.
Nice.
But again, I lost 165 pounds and I've
Whoa.
maintained it since 2008. I like my background is nutritional therapy and personal training. I do all the things and I practice what I preach and I get the sunshine and I have Irish sense of humor. So we laugh and dance a lot and sing. But I went through a very, very stressful time applying for permanent residency in Canada. And that's when I knew that this was all stress because it just hit me hard. And then after that, I just have a lot more awareness. But back to what we were saying, I don't think people realize at any age, it doesn't matter what age you are, if you go through these massive periods of stress, it can hit you like a brick in the face.
Right. That's right. You are absolutely right. Very true. So,
So thank you for your time. You have your wonderful book
yes.
pre-officially out now, and it's
Yes.
on Audible.
Yes. And Audible too. Yes.
So I
New
got both.
information.
I got the hard copy. I'll share a link for everyone, and I got the Audible one as well. Um, I'm going to share the links below. Everyone follow Dr. Connealy. So it's Connealy MD on Instagram. Your
Okay.
Instagram posts are insanely good. And I don't say
Oh,
that lightly. And then Raina, I know you've some influence there. Last comment, if you don't mind, is I was looking at Goodreads and they were doing some reviews of your book. And I was like, hold on a second, this doesn't make sense. They were labeling it as pseudoscience and they were warning people against replacing evidence-based medicine with your advice. And I was like, well, hold on. She's a medical doctor and she cites nearly everything she says. What are you talking
exactly.
about?
Exactly. Where did you see that? That's very interesting.
It was up on, if you Google
I will.
Goodreads reviews of your book, you can see
The
the
new one or the old one?
it's the new one. It was the new one because I only looked
Oh,
recently in the last few days.
oh, wow. That is crazy.
But it is crazy because they're trying to label it a
Yes,
pseudoscience. And I'm like, well, even mistletoe, before you were even born, they were using mistletoe in
exactly.
Germany. How is that pseudoscience? German, I'm sure you know that the German Health Authority officially recognizes
Right.
mistletoe as cancer treatment.
That's right. You are absolutely right.
Anyway, thank you for your time. I'm sure you have appointments. I don't want to keep
Yeah,
you any
thank you for
longer.
your support and spreading the message of healing. I appreciate it. And you learned a lot from your own journey. And that's what it's all about is transforming the future of health and humanity.
Well, I know my cancer will never come back, but if it ever
No,
did,
the cancer.
if that, yeah, that cancer comes, I will be at your front door and I'll
All
be like,
right.
let's go.
All right. Come and visit anytime.
Thank you. Have a great day, Dr.
All right. Bye bye.